So first of all, I would like to thank Meenaji and Anand Bhai for inviting me for this wonderful occasion and giving me the first slot of opening the today's one day match. So my role is to talk on the physiological basis. I am sure there will be eminent yoga experts who will be talking more on the yoga therapy aspects in various mental disorders, but to understand the physiological basis is very crucial in understanding or designing better yogic therapy or any therapy for that matter. So I'll be talking more on general terms. I know the audience is a bit mixed here, so I'll be speaking on the mental disorders, introducing to you. Most of you are aware of this problems of mental illness in today's world, especially in today's stressful world. And I'll briefly touch upon different aspects of the mental pathophysiology in terms of genetics, how the environmental stress adds on to in developing these mental disorders, various alteration of neurotransmitter levels or neuroendocrine axis, psycho-neuroimmunological axis are all crucial in developing a mental illness, and some of the common examples of mental disorders. I won't go into details of these because the time given to me is just 30 to 40 minutes, and some of the investigation modes and some of the summary and the future direction. How I won't, I'll just briefly talk how yoga will act on all these physiological mechanisms and improving one's mental health condition. So mainly there are different theories in explaining the mental disorders. One of the very famous or well quoted theories, biopsychosocial theory. So there are some biological factors, some of the psychological factors and some of the social factors which will cause the mental disorders. Biology, it might be evolution, individual genetic factors, brain structure and chemistry. We'll talk on these aspects. Psychological aspects we know in the stress, physiological, psychological traumas, learned helplessness, mood related perceptions and memory. Social, we have different roles in the society, so different expectations in the society. So once we are not able to meet to that expectation, then there will be some kind of imbalances in this issue that would develop in developing the mental illness. So the meaning of the mental illness, it's a broad meaning. It could be anything when there is a physical, mental, social or spiritual well-being. This is a WHO definition of health as such. So mental illness. So personality of a person which uses various defense mechanisms in coping up with any adjustments. Whenever there is a stress, there is a defense mechanisms in the body to cope up that stress, but when the capacity to adjust to that of the individual is not able to adjust to that stress, there should be a stress, eustress, but when it becomes distress, then that lead to maladaptive behavior or mental illness will creep in. Broadly, we know we have two major classification of mental disorders, neurotic disorders, where the patient is still able to think rationally. He knows he is having some issues. That is one way it is good. He is still having that mind. But psychotic disorder, when person loses contact with the reality and he experiences irrational ideas or distorted perceptions. Again, we are talking in terms of a normal healthy being. We don't know which is normal when we talk in some of the mental disorders. That could be the normal, but when we are talking normal, we are talking the healthy person. Then burden of these mental disorders. These are the important ones that I have put in, and the numbers in Indian context. So, depression is the most common mental disorders. Almost 30% or more than that of Indian population, one point or the other will have this kind of issues with the depression. Anxiety is also another common one, around 30%. Bipolar disorders around 3 to 5%, lifetime prevalence of 4%. Schizophrenia is the number is increasing nowadays. Then Alzheimer's disease, alcohol and substance abuse and all those issues. Now, in general, how the interaction between these mental disorder and other medical morbidity. Here I have given an example of diabetes. So, say bipolar disorder or generalized anxiety disorder, eating disorder or obesity, schizophrenia can also lead to the physical disorders like say diabetes or hypertension. This we call as psychosomatic disorders. And also there is comorbidity with other mental illness like major depression is known to be associated with many medical disorders, be it hypertension, diabetes. When you are labeled as one patient, you will have comorbid depression along with that. That's the common finding in many of these disorders. Now, when we talk about the etiological factor, the causative factors, some we can name as physical factors, be it physiology, biochemistry, neurochemical factors or physical environment, pollution or nutrition, toxicity, infection. All these we can group together as physical. But there is one more entity known as change in the energy. So, nowadays there is lots of research being done in this area to understand actually the energy features which affect the thoughts and emotions, emotional environment. Then acupuncture uses most of these, even pranic healing or the nadis or energy centers in the body, electromagnetic pollution, psychological stresses, all these. So, when there should be the right amount of the ingredient to be present to be a healthy person. If one of these say person has genetic susceptibility, then he is added upon by stress in terms of environment, then some kind of energy or thought related processes working on that. So, all in good combination he will be healthy, all in bad combination he will have some mental illnesses. So, then there will be various triggering event, perpetuating factors, risk factors. Here risk factor I have put in the reddish color. So, there could be family or socio-cultural factors, cognitive impairment or communication difficulties, genetic, neurochemical or hormonal factors, family or socio-cultural factors, psychiatric comorbid conditions other than trauma, then post-traumatic stress disorder dissociation. So, there could be abuse or trauma or accumulation of life stressors. So, again the pathophysiology of mental disorder is not a simple thing. It is not just like a virus enters the body, there will be immunological reactions, but immune system, if it fails to remove the virus or the bacteria, there will be infection sets in. But mental disorder is a long standing process. Initially there will be coping up mechanisms, defense mechanisms or others, but after a time the person is not able to cope up, that leading to various mental issues. So, in terms of neurotransmitters, here I have put three main neurotransmitters: dopamine, serotonin and norepinephrine. Now, dopamine, we know it is involved in a reward, pleasure or obsession kind of thing. So, the level of dopamine increases in schizophrenia or manic condition, and the person has higher level of dopamine, or a lesser level of dopamine is seen in depression, ADHD and also classically is seen in Parkinson's disease. So, there is, it's a double edged sword, what we say in psychiatric or neurological conditions. If you give dopamine for a specific condition, say for depression or say for Parkinson's disease, if the dopamine levels goes up in the body, it might lead to some of the other psychiatric morbidity. So it has to be in balance. Then serotonin also, serotonin is decreased level is leads to depressive symptoms, more levels lead to anxiety or serotonin syndrome. Norepinephrine again decreased in depression and increased in mania and insomnia. So here there is a plot showing how the mood or the cognitive functions is a mixture of all these. You need to have a good balance of all these neurotransmitters. Here I have just shown three important ones. There are others, acetylcholine, glutamate, or oxytocin, so many other are there. So we need to have right balance of these neurotransmitters. If there is an imbalance creeps in, it leads to different mental illness. So one of the classical or the common disorders are the mood disorders. They are characterized by emotional extremes. It's not just we might, when we get up in the morning, we might have a bit depressed mood some days. That's okay, but the major depression what we psychiatrically define is having a consistent feeling of depressed mood for at least 2 weeks, and it is associated with the feelings of worthlessness or diminished interest of pleasure in most of the activities. So then there could be a bipolar in this particular condition. The mood might swing. It might go into elated mood, which is known as mania, or it might go into the depressive mood. So that manic depressive psychosis, what we call, the mood swings, and that swings happens very fast in some of the patients, and that will lead to severe conditions. Now mood disorder per se, statistics have shown, most of the studies have shown it is more common in females. There is almost double in the age group of middle age or young age, but when it comes to older age, it's almost equal. But in terms of suicidal attempts or suicide per se is more common in males, because maybe the risk taking behavior in males, and also some of the biology is different in these two genders. Now studies have shown that the blood flow or the metabolic profile of the brain per se is taken at a different mood swing states, be it depressed state or manic state. There is lots of difference. You can very well appreciate increased blood flow or increased metabolic state in the manic state. Brain is in active state, whereas in depressed mood it is in low energy state. So the brain chemistry, cognition, and the mood, all these act in a specific manner to lead to these disorders. So stressful experiences, negative explanatory style lead to depressed mood, or that again lead to cognitive or behavioral changes. It's a kind of vicious cycle. It's very difficult for the person to come out of this vicious cycle. He will go again and again into this vicious mode, leading to different issues in depression. So three main system if we can target for the development of the pathophysiology of depression. One is the neurocardiac regulation. There is changes in the brain because of so many factors, the limbic pathways and the depressive thoughts that are reverberating in the limbic circuits, that lead to decreased activity to the neurocardiac regulation. Then two other that lead to two other systems. One is the clinical features and the cognitive decline, decreased cognitive functions. Decreased cognitive functions that are classically seen in depression. The other thing is to the psycho-neuro-endocrinological axis. The HPA axis is getting imbalanced. So that we studied in a study in patients with the major depression, studying the alteration of autonomic functions in patients with depression at NIMHANS, and we found patients with depression had lower parasympathetic activity as measured by the maximum minimum ratio. When a person stands up from a supine position, there is naturally a decreased blood pressure suddenly, then there will be normalization, but that normalization requires your autonomic centers to be normally functioning. So that is bit impaired in patients with the depression, and also the more sensitive measures of heart rate variability, which is the variations that we see in the heart rate. Naturally, heart rate is not a constant thing, it fluctuates, but that fluctuation is impaired in patients with depression. So this again I am bringing in these studies just to emphasize that when something going on in the brain in patients with depression, there will be wider changes, be it on the heart, be it on the endocrine axis, or be it on the immunological axis, and these changes may in turn lead to more severe condition. These studies have shown patients with depression, they are more prone to develop cardiac events. So this is one of the explanation why the cardiac events are more common in depression. So again bringing yoga into this picture, yoga tends to yoga samatvam yoga uchyate, or yoga tends to bring in that imbalance to a more balanced mode, be it parasympathetic or sympathetic activity, autonomic nervous system, be it neurotransmitter levels, be it neuroendocrine system. So yoga tends to bring in that balance into our systems. So that's why yoga is tend to have positive effect, be it medical conditions or be mental illness. So one of those balances what we can measure using heart rate variability is a sympatho-vagal balance, that is the low frequency to high frequency ratio. So in patients with the depression, we have seen they have higher sympatho-vagal balance that is modulated by different antidepressive therapies. We have used tricyclic antidepressants, selective serotonin reuptake inhibitors, and RTMS, that is repetitive transcranial magnetic stimulation in this particular study. And you can see the in sympatho-vagal balance, which was around 1.7, it decreased in these two group of patients who are on selective serotonin reuptake inhibitors or RTMS therapy. So to say that not only their depression symptoms improved, but also the autonomic balance improved with this therapy. So we need to figure in these changes happening in patients with depression and to treat. And we are planning in our center yoga study also along with this, to see yoga alone or yoga in combination with other antidepressive therapies, how it can improve the sympatho-vagal balance. The other similar therapies using brain stimulation techniques, the transcranial magnetic stimulation. This is one of the approved FDA approved therapy for depression. The left dorsolateral prefrontal cortex is tend to have lower metabolic activity, so you can stimulate that with this magnetic coil, or you can put a electrical strips to identify the brain EEG, and we can do similar studies to understand the changes of the brain stimulation to that of the ECG, EEG, and RTMS, which is given over the brain as such. It's kept, it's a non-invasive type of stimulation. So when we stimulate the left dorsolateral prefrontal cortex, it changes the brain circuits, the combined effect of magnetic and electric, showing whether various dynamic system changes. and that again lead to so many neurotropic effects and neuroprotection effects, and the changes, even studies have shown changes to that of the genetic factors also. So the other area in which many studies have been done is change in the HPA axis, the hypothalamo, pituitary and adrenal axis, which is classically get activated when the person is having stress. So when person is able to cope up with the stress by elevating the cortisol levels, then that's still within the scope of the defense mechanism. But when the defense mechanism fails, there will be hypercortisolemia, increased cortisol levels, or also up a regulation of the receptors, the mineralocorticoid and glucocorticoid receptors, both at the hypothalamic levels or at the tissue levels, leading to severe problems of increased hypercortisolemia, that either treated either by RTMS or antidepressants, or by just by doing yoga, which can produces bring back that balance in the HPA axis. So there are various circuits involved again in depression. Studies using brain stimulation techniques or also neuroimaging techniques have shown different limbic circuits which are involved in the medial orbitofrontal loop or the lateral orbitofrontal loops are involved. Again, these we can use to modulate the brain circuits in such a way that the changes in these circuits will vary from person to person. So we need to before stimulating the person, we need to take up his brain imaging to understand the circuits involved, then stimulate accordingly. This is especially for very severe or drug resistant cases when we have to use brain stimulation, be it in non-invasive or invasive stimulation, where we need to put in deep brain stimulation kind of picture. So these are some of the studies showing usage of optogenic modulation that are seen in rat models compared to that of the brain stimulation, non-invasive as well as invasive stimulation, to understand the changes in the various reward circuits and the limbic circuits to understand the mood disorders. We will move on to the next important one, the anxiety disorders, and this is very common, especially generalized anxiety disorder, which is very prevalent in the society, and the panic disorders, which is more severe, in which patient might have few minutes or longer episodes of intense dread, in which person experiences terror accompanying with other features like chest pain or choking or other frightened situations. And phobia is very common in general population. Each and every person will have some kind of phobia, and obsessive compulsive disorder is also a common thing. This is many people are surveyed in this particular study, and they have seen most of the people have a fear for snakes. It's they feel it's a creepy creature in which it can crawl or it can do very nasty things. So 40% of this particular study, they had some kind of fear of snakes, whereas around 20 to 30% had some amount of botheration by this, or 30% of the people. And different persons will have different kinds of fears. I'm sure if I take a survey in this audience, many people will have many kinds of fears, and we need to understand what exactly causes this fear, or it could be solved by psychological means, be it counseling or other techniques, or we need to understand more on this aspect. Then PET scans or other imaging techniques have used to understand the pathophysiology of these, and to lastly talk on the schizophrenia, the split mind, or the disorder in which there is disorganized or delusional thinking, disturbed perceptions or inappropriate emotions and actions. So delusions is a false belief whereas hallucination is sensory experiences without actually sensory stimulation. But again, as I pointed out in the beginning, that could be like the things that we cannot sense with our normal sensation, but these people might have, just like dogs can hear ultrasound or low frequency sounds. These people can have that ability to hear or see something which normally we cannot see. So there are different types of schizophrenia, be it paranoid, disorganized, catatonic, undifferentiated, or residual types. Then causes of schizophrenia, it's again both chemical and anatomical differences in the brain. There are various theories causing like some viral infections in the pregnancy, and also lead to the developmental disorders kind of thing, seasons of birth or viral epidemics, population density and latitude, malnutrition or prenatal stress, various factors. And also studies have shown identical twins have higher chance of getting compared to the fraternal non-identical twins. It's almost fivefold, 10% to 50% in across the population. So general population, there is chance of 1% of getting this particular condition, whereas 10% in first degree relatives, 45% or up to 50% in identical twins. And different probands have shown various genetic factors involved in this particular condition. So there is a genetic predisposition is possible, and the vulnerability to this mental disorder, be it schizophrenia or any for that matter, there is minimal stressful circumstances in a person who is not so prone to develop genetic. There is lower probability of getting mental disorder. On the other hand, if there is some childhood trauma, there is some genetic predisposition, then there is excessive stressful circumstances that definitely are a higher probability of developing a mental disorder. So in terms of different levels, person might have some genetic issues, then that lead to decreased neuronal firing or decreased neurotransmitter levels, that lead to some amount of changes in the thickness of or the functioning of neuronal orchestra or the circuits, or reduced neuronal activity during working memory, or deficits in the executive functions. So at different levels it goes, finally leading to a psychiatric conditions like schizophrenia. So there are various studies showing that the lateral ventricle size or the temporal or the frontal lobes, anterior hippocampus, decreased gray matter in the left temporal lobe. But again, there is not a clear picture has not yet emerged on the pathophysiology of schizophrenia, how exactly from the genetic to the system level, how it but there is a common notion that there is increased dopamine release in the nucleus accumbens because of the hypofrontality features, and that again the DA receptor levels also, there is dopamine receptor levels, there is changes, and that causes the positive symptoms, the hallucinations or the delusions that are seen in schizophrenia are associated with that. The other systems, to cover other systems, one, the major research is going on in this gut brain axis. The brain has a control over the enteric nervous system and the gut things, mainly through the vagus and its branches, and brain receives lots of input from the various neurotransmitter, also changed microbial structure. So that could have some effect on this particular loop. Any disorganization, be it neurotransmitter level, be it microbial levels, or the input output to the brain and the gut, leads to various disorders. So we have seen at different levels, genetics, fetal development, inflammation, neuroendocrine functions, then various social factors will lead to various mental illness, and also the psychosomatic disorders, obesity, diabetes or hypertension, cardiac factors are all nowadays are linked. The other important thing is the changes in the sleep. Sleep is the state in which it is meant for relaxation for the whole system. But disorganized sleep is seen in most of the mental disorder, be it depression or be it schizophrenia. So the person or the body is not able to rejuvenate during sleep. That leads to again that vicious cycle of mental illness. The other thing is the neuroendocrine and immunological axis that we have touched upon briefly. So to summarize, different factors like inheritance or upbringing, trauma, infection, nutrition, various biochemical, neurochemical, neurotransmitter level changes, or the drug abuse lead to the mental illness. So to conclude, mental illness is a major problem in today's society. Various factors like genetic, environmental triggers, modern day stressors in life, or involvement of specific regions in the brain as well as neurotransmitter system lead to various mental illness, and these mental illness per se will lead to several other psychosomatic disorders. We can identify these with various comprehensive multitudinal measures with neurochemical, neurophysiological or neuropsychological. We need to understand these mechanisms well to bring in preventive strategies. And I am sure in this seminar many yoga experts are going to talk more on how yoga could be brought in this regard, especially for the preventive aspects and also the promotion and treatment aspects in various mental disorders. Thank you for your kind attention.
We thank Dr. Kaviraja Udupa for this very excellent presentation today, and I request Ammaji to present a memento and bless Kaviraj, who has been a dear friend of mine since I think it was 2000. Since 2000, when I was starting off my research work in JIPMA. So I request Ammaji to please give away this memento of appreciation at this time. And Kavi has He is a very dear soul. In fact, we consider him as part of family, and Kavi very much is like a younger brother to me. Not like he is a younger brother to me. And I'm so happy to see the way he developed in NIMHANS. Amazing work he's been doing, and then he was in Toronto, getting the experience of being in Canada, being out of India, seeing the world in a different way. I think it is so important we have these different dimensional perspectives. And now again back in NIMHANS, so I told him this morning, we are going to be pulling you to Pondicherry many times. So we once again thank Kavi. Let's give him a big round of applause.